Hernias are weaknesses in the belly wall, which can allow fat or intestines to bulge through. The most common type occurs in the groin area, that is the part between your legs. Researchers estimate that about 27% of men and 3% of women will develop a hernia at some point in their lives. Welcome to Ashirvad Hospital Bidar channel. In this video, let's know all about hernia, its causes, symptoms, treatment, and also know how we can prevent it. So let's dive into the video. What is hernia? A hernia is a weakness or opening in the belly abdominal wall which often results in soft tissue such as fat or intestine protruding through the abdominal muscles and occupying the space under the skin. The mechanism of a hernia is like what happens with a bulge in a damaged tire, where the inner tube, normally contained by the hard rubber of the tire, extends through a thin or weakened place. The opening in the abdominal wall that leads to the hernia is also known as a hernia defect. The following are some of the important types of hernias. Groin or inguinal hernias are the most common of all hernias and occur near the crease between the lower abdomen and the upper thigh. 10 to 15% of men and 2% women may have groin hernias in their lifetime. When a groin hernia develops, intestine or fat may protrude through the defect in the abdominal wall, creating a bulge on the right or left side. If you see any of the following symptoms of inguinal hernia, then contact our hospital. A bulge in the area on either side of your pubic bone, which becomes more obvious when you are upright, especially if you cough or strain. Discomfort or pain in your groin, especially when bending over, coughing or lifting. A burning or aching sensation in the bulge. A heavy or dragging sensation in your groin. Do consult us if you see these symptoms. Umbilical hernias. These occur in the part of the abdominal wall above or below the umbilicus, that is belly button, and or within the umbilicus itself, where they are called umbilical hernias. They are less common than groin hernias. The other types of hernias include lateral hernias, femoral hernias, incisional hernias, and epigastric hernias. Most hernias are not serious, but they can be. A hernia becomes serious when it gets stuck in the hole that it is pushed through and can't go back in. This can become painful, and in severe cases the tissue can become cut off from blood supply, causing necrosis, tissue death. Since hernias tend to worsen over time, most will need surgical repair sooner or later. Anyone who has a hernia should undergo an evaluation for repair. And every hernia should be evaluated by a surgeon. Surgeons will evaluate to identify factors that need to be modified to minimize the risk of complications, such as control of diabetes and smoking cessation. They close the hernia either by pulling the muscles at the edge of the hernia together with stitches or by placing synthetic mesh material over the defect. What is the expected recovery time after hernia surgery? You should be able to return to work after 1 or 2 weeks, although you may need more time if your job involves manual labor. Gentle exercise, such as walking, can help the healing process, but you should avoid heavy lifting and strenuous activities for about 4 to 6 weeks. The next step if you are dealing with a hernia is to visit the Ashirvad Hospital Bidar. We can help you by curing the problem. Our center offers treatment not just for hernias but many other medical problems. Hernia, hydrocele, piles, fistula, gallbladder surgery, appendix surgery, colon surgery, diabetic wound management, skin grafting, etc. are performed in our hospital at very low cost. Our intention is to reach as many people and offer our services to all those in need. For more information, contact 9380339342 or 084824091113. If you found this information to be helpful, please like and share. If you haven't subscribed to the channel yet, please do subscribe, press the bell icon and take a step towards your health.